Welcome back to Good Morning Arkansas. Today we are talking about bariatric surgery at Arkansas Heart Hospital. So joining me today is Dr. J.J. Tucker, who is a bariatric surgeon, and Jeremy Thurman, who is a patient from the Bariatric and Metabolic Institute at Arkansas Heart Hospital. Gentlemen, thank you both so much for joining me. But Dr. Tucker, I'll go ahead and start out with you. How is a weight loss surgery such a benefit to patients?
Weight loss surgery is a benefit to patients because it offers a chance at disease cure. Really, our primary focus here at the Bariatric Institute is to help patients cure themselves of their diabetes, hypertension, hyperlipidemia, sleep apnea, some of the most common diseases affecting the majority of the Arkansas population.
What options are available there at BMI?
Here at BMI, we offer laparoscopic approach to weight loss surgery. Those surgeries include laparoscopic gastric sleeve, laparoscopic gastric bypass. We also do revisions in terms of gastric band removal, and we offer these in a minimally invasive approach so that patients are allowed a very short hospital stay, a quicker return to work, and they can integrate back into their normal routines fairly quickly.
We'll hear from Jeremy here in a second to tell his story about Dr. Tucker. What kind of procedure did Jeremy have or undergo, and what made him a good candidate for that?
Well, Jeremy had a lot of medical problems when he came to see me. He was suffering from diabetes, hypertension, sleep apnea, and because of the severity of his diseases, we had talked about it and decided on a gastric bypass. Since that time, we're about 6 months out now, and Jeremy is no longer has any disease diagnoses at all. He has been cured of his diabetes. He's no longer on a CPAP machine. He no longer takes medications for hypertension.
Jeremy, why did you end up seeking out help from BMI, and how are you feeling now after the surgery?
Oh, I'm feeling great after the surgery. Everything's just wonderful, and I just reached out to them because I knew I wanted to change my life. I needed to do something. I needed to get healthier. And because of Dr. Tucker and everybody here at the Encore Hospital, I have a new lease on life.
So some of the problems that you were experiencing in the past, you're no longer experiencing?
Yes, my blood pressure is great. I'm the truck driver, and I've gotten my CDL, my DOT physical. I was getting one for 3 months or a year at a time. I've passed it, and I've got one for 2 years, and it's helping me with my life, with my girls and my wife. And like I said, I'm just blessed, and I feel like I have a new lease on life.
How would you describe the type of experience that you had there at BMI at Arkansas Heart Hospital?
Dr. Tucker is wonderful. He explains everything thoroughly. He's a real nice guy. Everybody here at the Heart Hospital, the nurses, the staff, the support system that we have here, they're above and beyond great. And I just want to say, if anybody's looking to better their life, take the chance, get the courage, come in and ask for help like I did.
Dr. Tucker, if somebody is curious about if this can help them or just a different surgery that may help them, how would they reach out to you, or what's that first step in getting that help?
Well, the first step for us is, we try to make this very easy for the patients. We have a website with on-demand videos that kind of an introductory tutorial or education about the process and the procedures, and they can go to bmi.arheart.com and access those videos. We also have a couple of upcoming live seminars. We'll be hosting an in-person live seminar with question and answer session at the Hot Springs Clinic on June 22nd. And we'll also be hosting one in the Texarkana, Arkansas, or Texarkana, Texas Clinic on July 27th.
Okay, gentlemen, thank you both so much for joining me today.
Thank you, Ainsley. Thank you for having us on.